Well, what we're seeing is an explosion of direct primary care, and people are looking for ways to lower cost. It's just getting heard about on a legislative level at our state in South Carolina, and so we're trying to make some inroads there, trying to get a little bit of direct primary care protection, and trying to build up more free market awareness really for the whole state.
I am an independently owned and operated primary care practice in a relatively small community in Southwest Florida. I'm not the Mayo Clinic, I'm not Cleveland Clinic. I see patients from all over the state of Florida for their primary care because they come to us, they're attracted to us. They drive 2.5 hours from Miami, they drive 3 hours from Orlando for primary care. Patients might go to a clinic in Miami and they're going to wait 2 hours to be seen. And their doctor's going to ask for a test, an ultrasound. And they'll call our practice and they'll say, my doctor in Miami wants to do an ultrasound and it's $900. How much is it going to cost if I get an ultrasound done through you? And we say it's $120. And they say, okay, how soon can you see me? Can you be here tomorrow? Okay, so it's a simple conversation that's drawing people from far away for value, for quality. And so I would say that we're extremely well received by the community.
Just the convenience of being able to get in to see the doctor when I need to see the doctor and not be rushed through in 5-minute increments is very, very important to me. And so the care that I'm getting now, and when I need to call something, if I call out here for a prescription, it's at the doctor's office within minutes. And it used to take me days to put a request in online or call and get a prescription.
The setup for a direct primary care doctor is different because we intentionally have fewer patients, and that's so we have time for those patients when they call in. We can make time in our daily schedule if they need to be seen for something quick without having to worry about what urgent care am I going to go to. We also can make sure that we have longer visits. Our short visits are 30 minutes. Our long visits can be an hour, sometimes more if we know you need it. I am a family doctor, but I'm also trained in obstetrics and women's health care, and I love taking care of the entire family, moms, babies, grandmas, grandpas, and I've taken that care into the direct primary care model. I offer a cash-based service for your prenatal care, your delivery services. Every visit is with me. And I offer that for a very discounted wholesale global rate. It even includes your lab and prenatal costs. So we've got the freedom to not have to worry about how we code and turn things into an insurance company. We set up an appointment at a grocery store. And I went grocery shopping with a guy and showed him how to read labels and how to make better health choices for his diabetes. When he came in to me, his blood sugar was over 400. 2 months later, his blood sugar was between 100 and 120 on a regular basis.
It's exciting to me, but it saddens me that that's necessary. But it also tells me that we're filling a void that is absolutely necessary, that I think we need to grow in this country.
My dream would be to have a free market idea basically in every state. So our state of South Carolina has an awesome surgery center that we can send people to. An hour down the road, pretty much from everybody in the state has a place like that they can go. Every community has a advanced imaging center where they can get free market. They can get a good price for a CAT scan if they need it. And then hundreds and hundreds of direct primary care doctors forming a strong wall for primary care and really keeping people out of the hospital, trying to keep them from going back to the hospital, and really see costs lowered across the whole state. And if we could do that in every state, it could really make a big difference in lowering the cost of health care for the whole country, really.